Hi, my name is Dr. Allyson Ocean. I'm a medical oncologist specializing in pancreatic cancer.
And I'm Cindy Gavin, CEO and co-founder of Let's Win Pancreatic Cancer. Dr. Ocean, what areas of research are looking most promising?
Right now, the most promising area of research is around the drug class that we call KRAS inhibitors. KRAS is a gene that drives the growth of pancreatic cancer. This gene is present in over 90% of tumors. Scientists have developed blockers of this mutation. This mutation causes growth of the tumor. So now what was thought to be undruggable, they never could achieve this before, now is druggable, meaning that we have a drug that someone can swallow, it goes into your system, it gets broken down, it goes to the tumor, and inhibits the growth pathways of the cancer. And this is the most exciting treatment option that will probably soon be available for patients.
So this is an oral drug?
Correct.
And side effects?
Of course, yes, there are side effects, but for the most part, that's the good thing about the data that we're seeing, that the side effect profile is very minimal, and patients are tolerating the medicines very well.
That's great. One of the biggest challenges is that pancreatic cancer is very often caught late. Unlike colon cancer, breast cancer, prostate cancer, where there's standard of care screening, there's no standard of care. I know we've made some progress with surveillance in high-risk patients, those with a genetic disposition to the disease and a family history, maybe a BRCA mutation. We've learned a lot about the link with diabetes and new onset diabetes, especially with unintentional weight loss. What is the status of early detection? Are there new tests that patients, and especially those at high risk, should know about?
This is also an exciting field because they are developing screening tests that soon will be a blood test that a patient can take and can tell them, do they have pancreatic cancer, among other cancers. So these molecular blood tests are available now for certain cancers, but they're honing in on the science of it and making it more specific to detection of pancreatic cancer. Those tests are in trials. Some of them are commercially available. They're starting to screen the high-risk people first with these blood tests.
That makes sense.
But eventually they will open it up to the general population or relatives of people who have been affected by the disease. So we'll have a screening test, a blood test, one day. They're also working on, you mentioned the diabetic population, people who have new onset diabetes are at risk for developing pancreatic cancer. So we're trying to get education and initiatives around discovering these patients that get diabetes newly in their 50s, 60s, and ask the question, could their diabetes be related to pancreatic cancer? We know that new onset diabetics do have an increased risk. So we're trying to reach out to the internists and the endocrinologists and the doctors that see these patients when they get diagnosed with diabetes so that we can educate the physicians to actually think about potential pancreatic cancer as a diagnosis in these patients, as the cause of diabetes.
Because sometimes it's a precursor, really.
Correct.
It's early stage
Right.
pancreas cancer that is manifesting
As
diabetes.
Right.
We're seeing so much progress, and that there's more.
We really are.
There's really more tools for specialists like
Yes.
you to be helping patients. Think out of the box. Have different options available.
Yeah, last week we were in Boston for the AACR Pancreatic Cancer Conference, and it was so amazing to see hundreds of scientists and clinicians dedicated to the research of this disease. And I left there feeling so much hope because I really think we are on the verge of something big in treating this disease and getting a hold on the growth of it and leading to better outcomes. I really do, because I saw the science in action presented to all of us. Every day there's more and more science coming out that is very promising for patients with this disease.